All right, as you might know, October is Breast Cancer Awareness Month, and we're highlighting a place in our state where you can get the best care for high-risk patients.
I visited the high-risk clinic at UConn Health to learn how new advances in genetic testing and screening can really save lives. Liz Johnston is a breast and lung cancer survivor.
Wow, God bless.
Yeah, she's at high risk because of a rare gene she carries.
Take a look.
I have a pretty rare genetic disorder that is called Leigh-Fraumeni syndrome, and it's basically a predisposition to multiple cancers, breast cancer being a primary cancer of the disorder.
Liz comes here to the high-risk clinic at the Carol and Ray NEAG Cancer Center at UConn Health. She comes for genetic testing and special screenings.
My experience at UConn Health has been phenomenal.
We met up with a doctor on Liz's team, Dr. Dana Scott, who's a gynecologist that specializes in women who are at high risk for breast cancer.
We're standing outside this beautiful new center, and as breast cancer rates already in Connecticut tend to be a little bit higher than the average in the nation, what's important for people to know?
So it's important for people to know their family history and their own personal risk for breast cancer. So that can help determine whether they qualify for average risk screening, or some women may be eligible for a more high risk screening and risk reduction. So just kind of having a good sense of your family history and your own risk is really important.
Liz goes for special screenings now due to being high risk for cancer again. But some women may not know they're at high risk, which is why it's so important to research and share your family history with your doctor.
What would be an example of a high-risk family history? Does it have to be your mother or sister?
No, it can be on either side of the family. That's a really common question I get, is whether or not cases on your dad's side count, and that absolutely is true. So the things we worry about would be more than one case of breast cancer on the same side of the family, and particularly early breast cancer, so cancers diagnosed before the age of 50 or 45 are more concerning.
It means that you might need more than a mammogram.
Mm-hmm. Exactly. So women who are at above a certain risk threshold qualify for more screening. So that might entail starting screening earlier than the average age, which is usually somewhere between ages 40 and 50 that women start mammograms. And then some women also qualify for screening breast MRIs, which is a different test that helps to screen for breast cancer.
And the doctors here are constantly updated on the latest research that could affect patients like Liz.
This clinic helps me know that there is somebody else looking at this specifically that knows, from a medical perspective, how that's going to impact me as a high-risk patient.
They also rely on genetic testing to predict risk. Connor Linehan is a genetic counselor at the UConn Health High Risk Clinic.
Connor, one of the things that people may not realize is things have changed, and there's actually more advanced testing now.
That's very correct, yes. So we have thousands of genes inside the human body, and when we were initially starting our cancer-based genetic testing, we had very limited resources, and we could only look at a handful of those. And since then, we've come just leaps and bounds, and there's now dozens more genes that we are able to test for now that we were not able to test for when it first entered the market.
The first step is a conversation to see if genetic testing is right for you. But actually getting the test is easy.
It's one vial of blood, can usually get it day of, and then it's off to the races.
And what does it tell you when it comes back?
That's a really, really fascinating and multifaceted question. So usually what we can learn is that a person may or may not have an elevated risk of certain types of cancer, and that is all dependent on what's found on the test, what mutations a person may carry, if any, and where in the genes that those mutations are.
Learning you carry a high risk for cancer can be upsetting, but in the end, Liz believes knowledge truly is power.
It was very overwhelming in one regard to know that I had a predisposed reason, but on the other, it was a reason. It wasn't completely random. I didn't have, advanced stage breast cancer and stage 1 lung cancer for no reason. So in some ways, having the answers was a relief in that it gave me an action plan.
What's something that you really wish people knew, but often they don't?
I think just the importance of knowing your family history and knowing your own risk is really important, and feeling empowered to bring it up with their doctor and kind of have this conversation to see if they qualify for additional screening. I think that's really the most important thing.
So it is important to find out if you don't know. And as for the future, doctors at the High Risk Clinic hope that more people will become aware of genetic testing and the advanced technologies that are available to high risk patients. There's a lot out there.
Absolutely. You can find out more at health.uconn.edu.